everyone, and welcome to the Mommy and Baby Show. I'm your host, Mercy Tetu, and today we're on episode number 4. Today we'll be looking at what are the key signs of labor, and also we'll be looking at what you should pack, what you should have ready before you go into labor. And to take us through this topic is Nurse Kisera here at RFH Kiambu Road, and she'll be explaining in details what are the things you should not miss. Thank you so much for being here, Karibu. So before we get into our questions, maybe you could just tell us a little bit more about yourself.
Okay, I'm Kisera Eunice, registered nurse, based in RFH Roy Branch, and I'm a lover of mother and child health. So I'm MCH and maternity nurse. Yes.
Okay, thank you. So just to kick off, we are talking about labor today, and what are the key signs of labor. So to begin with, what would you say are the main signs of labor, and we can tell that this is true labor?
So for the main signs of labor for a mother, so we only tell you what you are able to feel or what you are able to see. So one of them is regular and increasing in contractions. They feel like menstrual cramps, but they increase with time and they are very regular. So you can feel them and they're very rhythmic, that you can tell after every 5 minutes you are having a contraction. This continues like 1 hour. So that's one sign. Another sign could be bloody show. Bloody show, you can see a mucus with a tint of blood coming out from your private part. So that's another sign of labor. So another one is water can break, amniotic fluid rupturing at any given point. So how will you know it is amniotic fluid? It is very steady with the flow, and the smell is different from, let's say, urine. Urine is ammonia, but now for the show or for the amniotic fluid, it is metallic. It has metallic smell. And it's a steady flow, and you can tell this is not urine. Yes.
Okay, so those are the 3 key signs.
Yes.
Okay, I've heard also about losing something called mucus plug. You lose a mucus plug. Is that still part of labor?
It is still part of labor.
And what is that exactly?
So mucus plug is when your cervix is getting ready. So we lose a mucus plug to pave the way for the cervix to soften ahead of dilating.
Okay.
So that's another sign of labor.
And I've also heard that you lose it over time. Like you can lose it maybe 3 weeks before you give birth.
Sure.
So it does not mean that I'm losing it now and I'm going into labor.
Sure.
So that is also correct.
It is also correct.
Oh, okay. And is it possible to lose it and not tell that you had it? So it
Sure,
was
it
your
can
mucus?
bypass you.
It can.
Yes, it can.
Because it comes out as usual, like normal discharge.
Yes, but now it is thick and mucary.
Oh, so you keep losing. So is it standard? Everyone loses it at any time you can miss?
It is not standard for everyone.
Okay.
Every mom is different.
Yes. So not everyone loses a mucus plug?
Not everyone loses a mucus plug.
Yes. But it's still, okay. All right, that explains that.
Some may actually develop mucus plug towards in between their labor.
Oh,
yes, thereabout, yes.
When labor has already kicked. Oh, okay. All right. So moving on, we hear about the contractions you've already mentioned, but that there's also something else called Braxton Hicks. Maybe can you tell us what exactly is Braxton Hicks and how you differentiate between that and the
So for Braxton Hicks, it's you will tell if it is a Braxton or not, because a Braxton is not regular, it is very irregular. Then it doesn't last for long. And for Braxton, if you change position, it will ease in, and it's a little bit of discomfort and not painful. But for labor pain, it's very painful, very regular. You can tell after every 5 minutes, let's say within an hour, you are getting contractions, which are very strong with the time.
Okay.
Yes.
So with change of position,
it isn't for Braxton.
For Braxton,
yes.
And do they also occur at the same place? Because I hear contraction starts from, you can explain. I don't know which starts from the belly to back and back to belly. And it helps you differentiate that this is not a real contraction. So which is which?
So for contraction is lower, it's based on the lower abdominal. It could be going to your lower back or not. So it could be lower back, not going to your front, or lower abdominal pain going to your back. For Braxton is all over your belly.
All over.
Yes, yes.
Oh, so at no time does it go back. It
No,
does
it
not
doesn't.
move.
It's just here.
So it's mainly concentrated on this
sure.
area.
Yes, yes.
And it changes with activity.
Yes.
So if I drink water, is that true that the Braxton Hicks
will go away? For Braxton it will go away,
does.
but for real labor it doesn't go away.
It doesn't go away.
It doesn't go away.
So
no matter what you do, it is there to stay.
It will not go away. So what of those people who say that you get contractions but they're not that strong that you don't go to hospital, you stay at home?
So we have slow labors. Those who labor very slowly. You feel tiny of crampy, but the characteristic is the same. It's very regular. It gets tiny stronger. It's slow, yes, but it gets stronger. You could feel the last contraction or the strength is not the same as the one which is coming. So you can also, we have those ones. So that's why we say even if you feel a little bit of the pain, please go to the hospital so that we are able to rule out whether you're having Braxton or the real labor.
And there's no risk of getting to the hospital and being sent home because you're very early and those are very minor contractions that you can manage at home.
Since we have different mothers, we always advise it's better you come, we tell you we are still not yet there. You can go home and rest and then come back later.
But the key is get to hospital regardless.
Sure. Regardless.
Okay, all right. So when is it, this ties to what we were saying, you still need to go to hospital, but is there the best time to go to hospital? If I feel genuinely I can manage, I'm anxious, I'm a new mom, I've had stories of people giving birth and they're scary, and it's late at night.
Sure.
I don't want to go to hospital. Is it okay to wait? Or when is the best, when should I just go to hospital?
So it depends. If you're a first-time mom, your pattern could be different from another first-time mom.
Okay.
I could be experiencing only the bloody mucus discharge, or rather mine is just the crampy pain, which is increasing and is very regular.
Yes.
So we always say, and if you're not a first-time mom, let's say for example, it depends with your pattern. Maybe you're on baby number 2. This pain can come in a different way from your baby number 1. So we always say, if you see the signs, the cardinal signs that we talk about, it's always okay to go to the hospital. It could be too early and it could be too late because let's say you're a slow laborer. So by the time you're getting there, we're already late for you, for your case. Yes.
So either way, you should...
Please, you should come to the hospital. Yes, it's advisable.
Okay,
like that.
all right. So is there any risk of arriving too late? For instance, I decided not to go because I have slow labor. I don't have any pain. I've decided not to consult. I'm just going to wait it out. So is there a risk of me, the mother who chooses not to go to hospital when she first starts getting the contractions?
There are risks associated with you getting to the hospital late. Let's say you ignore your pain for like a day, or let's say for hours, let's say more than 6 hours. So let's say for instance, a mother comes to us with a little tiny crampy pain for the past 1 day. So when we do vaginal exam, she's 6 centimeter dilated with no strong contraction. So what happens to this mother if she ignores the whole day? She will deliver en route when she's coming. Then there's some medical or maternity complication which comes with coming late. You could be experiencing something, let's say cord prolapse. Cord prolapse are obstetric and emergency. So if it happens when you are on your way, within 20 minutes we can lose the baby.
What is cord prolapse?
Cord prolapse is where the cord present ahead of the presenting part.
Sorry?
It comes ahead of the presenting part. Let's say the cord itself slipped through your vagina.
Oh,
yes.
By
itself. You are laboring. It is a process.
Okay.
So that can happen. So you can imagine if you come late, and that happens when you are in the house. So by the time you're getting to the hospital, it could be late. You can do something, but it's already late.
It's already late.
So the complication associated with the labor, we are trying to avoid. So the early the better.
The early the better.
Yes.
So do not wait it out at
Do
home.
not wait until it is too late. You never know your kind of labor.
You never know, that
Yes,
is
sure.
true.
Yeah.
So going to the hospital, at least when you're in your last weeks, you keep hearing you need to have your bag ready. When would you say is the best time I need to, at least which week should I know I have to have my bag ready? And what are the essentials needed in my bag for me as the mom and also for my child?
So for week 36, if you're monitoring a normally we always say if you're monitoring a mother, they will deliver normally. So our normal means at 36 weeks your bag should be ready. We always say let the bag be around the corner towards the door so that anybody else is taking to the hospital can able to just grab the bag and leave. So by week 36, your bag should be ready. So for your baby bag, should be a mitten. We say at least 2 pairs, a mitten, a socks, okay, bodysuit. It could be short sleeve and long sleeve bodysuits. There is flannel, the baby receiver, at least 2. You can have one warm shawl and one not very warm baby shawl. You don't forget your cap for the baby also, and for the diapers. So for diapers, we encourage you carry 10 to 15 of them, because there will be changeover and we are monitoring the baby, the urine and the output for the poop.
Okay.
Yes.
Can I ask a question before you proceed? When you say 10 to 15, isn't that allowed for a newborn? Will the newborn pass during that much and do that much when they just got born?
For a healthy newborn, it is not more. It is just enough.
Oh,
yes.
That is
We're monitoring the poo for like after every for the new moms, you know, you will keep on changing. So you'll have the urge to, you want to change your baby. So we advise you carry 10 to 15 for a start.
Yes. I think new moms usually carry a little because you don't think that the baby has that much to go with.
But at the end of the day, now you come very anxious. Now you want to change and want to change more often. Then you don't have enough.
Then you don't have enough.
Yes. Yeah.
So yes.
So for the mom, you just carry comfortable clothes, because for the hospital it will provide you with the hospital uniform. So comfortable clothes for you coming and then you're going. You carry socks. It depends with the situation. You can carry socks and a warm, maybe a jacket or a sweater. Then you also need to carry your toiletries for if you need some. Then snacks, we encourage snacks. So carry enough snacks so that it gives you the energy during labor. And of course, after labor, some of course will give you even the breast milk. So we encourage snacks as well.
Okay.
Yes.
So considering I came to the hospital in good time, and so I'm going to labor while I'm in hospital, is it also okay for me to carry maybe like music? Can I carry my small Bluetooth speaker? Is that allowed?
We encourage. It is very allowed. It's always helping the mothers cooperate, and you dance and you forget about everything. By the time you realize I'm here, the baby is already here. So we encourage. Carry a small Bluetooth speaker with a music play.
That is allowed.
It's allowed.
And also you may say you can carry snacks as well.
You can carry snacks. We encourage you carry snacks.
Okay. So now that we are working with RFH, what does RFH provide the moms when they now?
So for RFH, we provide a basin, a small face towel, a bathing soap, a toothpaste, a toothbrush, and maternity pads for the mom.
For the mom.
Yes.
Okay.
Yeah.
Do you provide for the child, the baby, or that will be covered by the mother?
It will be covered by the mother.
That will be covered by the
sure.
mother. Okay. So other than the bags that I need to have ready with the clothes and all the other needs, what essential documents should the mother have ready, or maybe the partner, because maybe the mother in that state will not remember, but what should they have already packed when they're coming to hospital?
For the first thing you shouldn't miss is your NC booklet. The NC booklets which carry your history from when you realize you are pregnant. It carries a lot of information that will help anybody else, regardless of your state, to at least know your history ahead of your delivery. So your NC booklet, your ultrasound reports from day one, it's very essential. Yes. So each and every ultrasound has different findings. It will help us towards labor. Have you been having any issues with the placenta, with the baby, with the fetal heart rate at some point? So you also carry that. It also help us in a state whereby we are not able to get you to the ultrasound immediately to estimate how many weeks we are. Using the first ultrasound and the last ultrasound, and now when you are there, yes, it also help us. So if you are an insurance person, you are supposed to carry also your ID. Depends who the principal member is. Maybe your spouse or yourself. So ID of either of the two of you, and maybe an insurance card if you're using an insurance. Yes.
Okay, all right. Actually, that one I did not know about the ultrasound.
You should.
I did not
it's
know.
Very essential.
I've given birth twice, and I don't think I ever remembered to carry the ultrasounds.
Yeah, sure.
I think maybe just the last one that they did before, but I did not know that it makes sense to have it from day one. From day one.
Yes.
Okay, so how can a partner best support a mom during labor? In another segment, it was mentioned that you allow partners to be there with you while you labor. So how best can they support you while they're there with you as you go through labor.
So always say your partner is the sober one. Okay? So your partner plays a very essential role. He is your advocate during that particular time. You could murmur something that you need to talk with the nurses. He is your spokesperson. So you will speak, then you will translate or call the nurses to talk on your behalf. Okay? So emotionally, he is there to support you. You see, those small statements our partner should say, like, you're doing well, you got this.
Good
you know,
job.
it helps you ease in the pain, it reassures you, and it tells you, you know what, we got this, all of us. You know? So the partner, we encourage the partner to be there. So during labor, emotional support is very important. Encouraging your partner, you are the spokesperson. Rubbing their back, it comes in handy. You rubbing the back help. It doesn't make the pain to go away, but it isn't the pain. So she'll be concentrating on the rubbing of the back, then there's pain going on, then the labor is progressing. Okay? So during delivery, it depends. If you're in there, just telling your partner that push, you're doing great, you're okay, you got this, it's enough for us. So it will help your partner to know, we got this, we don't need to worry, you have your partner there. So that is during labor. If you need to take a picture for the memories, you're good. With the permission of the hospital, you take a picture for remembering later on.
Yes.
Then again, post-delivery, they also need you emotionally, helping with the fast breastfeeding. You're touching the baby, telling the baby you're doing great, the baby is suckling well, you know, it also helps. Take a picture or two with the mother and the baby. It helps with the memory. They say, I got this at some point, this is the one. Because kids grow faster. So you will miss an hour, you miss like the whole day. Then you miss day 7, then 1 month, then 1 year. So those small, it is you, you're the sober one, as we say. So take small picture for for good memories.
The mother is not the sober one.
She's not the sober one.
She's not herself at that time.
She's not herself at that
So you should also be there so that she can hold your hand, and squeeze you and take all that pain out on you.
Yes, it helps them ease the pain, and it fastens the pain, by the way.
It does.
Yes.
You mentioned
before you realize you're already done.
You're already
and
done.
Congratulations.
And you're thinking, I'll do this again.
Sure.
So you said for RFH, do you usually, if I want to record that moment, is that allowed?
So it is allowed, and of course we have a document that you sign against the same, so that at least you don't end up messing. You see, media has a lot, so we allow that. If we allow you, continue with the, of course, guidance of how you go about that.
So this is something we should ask before when you're
coming.
When
you're coming.
Sure. So I ask, what's allowed, what's not allowed. Oh, but it's something.
Do the do's and the don'ts during the photography or videography.
The videography. Yes. Also, it's something that I usually thought it was just allowed maybe for like celebrities.
No, if we allow.
So anyone can. I can come with my husband and he takes a video.
Yes.
Okay.
Can even come with your team, videography and the photography team, and still allow that. Yes,
that is good to know. Okay, so we discussed labor, and I've heard of early labor. So if we begin with the early labor, what exactly is early labor and how long does it last? Is there a time that a duration on how long this early labor will go for?
So early labor depends. We have first-time moms and of course a second or a third-time mom. So the hours are not the same. So for early labor, for the first-time moms, we say 16 hours. I know it sounds weird, it sounds a lot, but it's the early labor time for like 16 hours, latest 20 hours, as you labor. So it always depends. Somebody will say, with those strong contractions, you need to go for 20 hours. So it's always easy. You don't have strong or mild contraction. You just have mild contraction rather. You don't have strong contractions.
For the 20 hours?
For the 16 hours.
For the 16 hours.
Yes.
So for the 16 hours, I'm having contractions.
But they are very mild. Something you can lie on your left and it goes. You can even sleep for 4 hours and it doesn't wake you up.
Okay.
Yeah.
Okay. So that's for a first-time
mom. For the moms who have made the second time or the third time, is like less than 12 hours. That's early labor for you. So it depends with the pattern of your labor. Maybe you're in your third, the past 2, you only had 6 and 8 hours. Yes.
So if I'm a second, third time mom, it means I will labor for a shorter period of time as opposed to the time for the first baby.
sounds like a myth, but different pregnancy are different.
Yes, that's
yes,
right.
very different. Even if you give birth until baby number 10, you have a whole 10 books to write against your labor patterns and everything involving labor and delivery.
Yes.
So they are very different. It could be your first was like 20 or more hours. Then your second, you realize now, because last time I went early, let me hold on. If you realize you're holding on, the contraction gets stronger. Then you get to the hospital, then you are 8 centimeters. Then you are delivered, and then you are like, okay, it is only 4 hours. So it is different from one pregnancy to the next, from one woman to the next.
Okay.
Yeah, sure.
But if I'd already given birth before, I'm sure that, is it assured that my labor, regardless of how long it should be, it would always be less than the first time?
No.
So the first time I had 20 hours of labor, I can still have 20 hours of labor the second time round.
But you shouldn't. You can, but you shouldn't. It's a may or may not. That's why we say we have those hours that are separated for depending on the person.
Okay.
Yes. So it doesn't guarantee that if you labor for 20 hours now, this one is 4 hours. No. Yes, depending when it started and what we are managing during that particular time.
Okay.
Yeah, sure.
So for some, let me give a personal experience. I was already past 40 weeks. I had no labor signs. So and I was past my due date, and they told me I could not go back home. So I was induced. For the people who go through induction, our labor duration, is it same for us who are induced, or is it just as well different because every pregnancy is different?
It's different because every pregnancy is different. So induction is the only mean. The labor is not coming naturally, so we induce you to get labor. Yes. So by the time you're getting that labor, we still have the hours the same as somebody whose labor just came naturally. Yes.
So it does not take.
It doesn't
because
matter.
People are always told, do not get induced. Try everything you can to bring your labor on naturally, because when you induce, apparently you go for very many long hours. So that is a myth.
It is a myth. It is not true. So normally somebody can get induced and their labor peaks with dose number 1. Okay. Then there is me, mine peaks on dose number 4. Then there is a third mom, theirs peak on dose number 8. So it's different from one woman to the next. It depends during induction. How was your cervix prepared? Some have their cervix way much prepared. It's only that the uterine muscles could not coordinate to get to contractions. But the cervix is already there. So by the time we're getting contraction, we are dilating. We are dilating, we are delivering. So it depends.
It depends.
Yes.
Okay, so how best can a mom manage the early labor phase? Can she eat? Can she rest? Can she maybe sit on they're called bathing balls? Can she still be active during early labor? So
we say your normal self. What it allows you to do: eat normally, bathe normally, walk normally, talk normally, everything. So it depends with your labor. Sometimes it progresses. It gives you or denies you the chances of you can't now talk. You may not need to eat, but we always advise during your early labor, if you are able to eat, please eat. If you are able to walk, please walk. If you are able to swing on the ball, please do, because it isn't or it helps with the engagement or goes towards the dilatation and now delivery.
Okay.
Yes.
And what about what we're being told that it gets to a point you are not allowed to go to the loo or to the washroom by yourself when you're laboring? That is not during early labor, excuse me.
It is not during early labor.
So I can go with
advanced stages of labor.
So
during early labor you can.
Okay.
Yes, you can.
So at what stage will I not be allowed not to go by myself, that someone has to accompany me, or you're told just go ahead?
So if your contractions are strong on 6 centimeter dilatation, we won't allow you to go, because the next minute or the next 1 hour you'll be 8. Then you'll have the urge to push. Yes, so we don't allow. If your contractions are not strong, maybe at 6 centimeter you can still go. But now we are 8 centimeter, regardless whether your labor is strong or not, contraction, you don't go.
You do not go.
Because it could be you're feeling urge to push, not necessarily going to the washroom.
Going to the washroom.
Sure. Yeah.
Okay. So then, still a long labor, can your water break before the contractions begin? Because you always say that you start feeling the contractions, the pain, then it follows. According to the TV, sometimes when you see, they always feel then the water breaks and then they're rushed to hospital. So can it come
So your
before?
water can break, let's say even 12 hours later, you've not enter into labor. So it can. But you always say immediately your water breaks. If you're sure it is your water, please come to the hospital so that you are able to examine you. Because the risk associated with early water breaking is the infection. We don't want you to labor for long from the time that. So we're able to make intervention faster.
Okay.
Yes. So your water can break before contractions. Then some actually get contraction before water breaks. Yes, yes.
And then what are the steps to follow if my water breaks and I was at home? Just immediately go to hospital. Is it allowed for me to first stay home and take a shower, then get ready, or should I just go straight to hospital?
So we always advise, because in the hospital we have showers, okay? So you can just change your clothes and rush to us. Because some people will have their water breaks and they are fully dilated. So you never know what's happening until you get to us. Yes. So just have a change of clothes. If you are able, then rush to the hospital.
Okay.
Yes, yes.
Is there a chance of leakage while you are while you're en route to hospital, or does it mean when my water breaks, is that all my water?
No. So that's just the 4 waters, okay? So if water breaks, if you have somebody and you are still able to recognize yourself, you're still sober, get to know the smell and also get to know the smell and the color. So it should be clear. It being yellow or stinky yellow is not a good sign. It could be the baby's first poop. So know the smell and the color. Then change, wear a pad, then come to the hospital. Yes, because it will continue steadily, it will be leaking.
It's not all
it's not all at once. It's just the 4 waters. We still have a whole lot of amniotic fluid to keep the baby going. Yes.
Okay, so what happens for the mothers whose waters do not break? Why? What would lead to them now having to get it broken, for lack of a better word, at hospital? So
it depends with how your labor is progressing. Labor is having a combination of things happening during that particular time. There is contraction, there is baby descending towards the birth canal, and there is dilatation. Depending on how these are coordinated, your water can break or just bulge. Bulging means they are there, but they are not able to break by themselves. Maybe we don't have strong contraction, or the baby's head is not pushing enough for them to break. Yes, so what do we do when you're doing vaginal exam? It prevents us from, of course, penetrating to know how many centimeters you are dilated. So we break it during that particular time. So it depends on the coordination during contraction.
Okay,
yes.
So can I opt if I haven't had my waters break? Can I ask my nurse not to break the waters for me until it happens naturally? Can I ask to wait? Because we hear that if they break their waters, it's very, very painful. Can you choose to not have it done?
So you can't choose to have it done because one thing, for it to be, it is not supposed to be painful actually. It's supposed to be a little discomfort.
Yes.
You know, because you see somebody go in, prick the water, then it burst. Okay. So you can't choose to let it not to be broken. So we have to break it because sometimes we don't know what we are dealing with. It is water, it is bulging, yes. But what if it is meconium stain? It has the baby's poop. Yes. So we can only know after breaking it. So if we must break it at that particular time that it is bulging.
Okay.
So it is a must-do thing.
When you say you must break it when it's bulging, does that mean I've been laboring for some time, or does that mean when you're doing the tests, when you want to check how many centimeters I've dilated, is it that you measuring will tell that this is time to break her waters, or is it? How do you tell that I need to break her waters now? So
some mothers, the water will bulge at 6 centimeters, at 7 or at 8. So if you came at 2 centimeters, that means your water is not bulging during that particular time. So it's from the continuous vaginal examination that we realize now we are bulging. So you know, some that we get to the hospital, you are 4 centimeters, your water is already bulging. No. So it's always advancing stages of labor that the water now bulges, and now we break it.
You break it.
Yes.
So let me just ask again. So it's according to the centimeters, yes?
Sure.
So if it continues with as fast as I'm dilating, doesn't it mean that if I was at 6, you can wait for it to get to 8 for it to now do it by itself? Because now I'm assuming my contractions will get stronger.
So for labor and the health of the baby and the mother, every minute count. So waiting from 6 centimeter and 8, if you are in normal labor, that could mean an hour or 2 hours or an hour 30 minutes. So that's not something you can wait. So the early the better. So every minute counts. So you can imagine 1 hour, 2 hours. So you won't allow to get to 8 centimeter before we break the water.
Okay.
Yes, so as long as it is bulging, we break it.
We break it. So we've been talking about measuring how many centimeters you're dilated. I forgot for you to first share it maybe with a viewer who is a first time mom, and we're just talking about your measuring. Maybe we can explain what we mean by measuring and dilation when you're now in labor before you get into delivering the child.
So measuring means we are doing a vaginal examination. So vaginal examination, we do it through our hands using the hand of a midwife or a gynae or a medical officer or any other medical personnel who is attending to you during a particular time. So we access your cervix through your vagina. Okay, it's meant to be a little discomfort, but it's not supposed to be a painful procedure. Of course, we clean, we lubricate our hands so that you don't feel the pain, but a little discomfort.
Yes.
So that we access your cervix through the vagina.
Okay.
Yes.
So when we say the centimeters, we mean, what do you mean exactly?
So for centimeter is how the cervix is dilating. So for example, we have 2 centimeter is only when one hand can go into your cervix, the opening of the cervix. The one finger. Yes, sure. So the one finger can go into your cervix. So that is 1 centimeter, 2 centimeters, sorry. So for the 2 fingers is 2 centimeters. Yes. With 2 fingers, with the little space for 1 finger is 6. A little space of 2 fingers is 8. Then now when we are not able to even feel the cervix, now we are 10 centimeters fully dilated.
Okay, so how many centimeters do you have to wait for now to know that you're fully dilated?
10 centimeters.
10 centimeters, always.
Always.
Okay, and is there we already said that pregnancy is different for everyone. So there's no, at one point, can I say that maybe I will be dilating slowly when I'm first starting from 2 to 4, but is there a time I get to maybe 6 centimeters or 5 centimeters, that it will just kickstart, I'll just jump on, now it will go faster? Is there something of the sort?
Yes, there is. It is always unpredictable medical happening. We don't predict that you will dilate from 6 to 10 within 2 hours, okay? But it happens. It's called a precipitate labor, whereby you take the measurement of vaginal exam for your mother at 12 midday, they are 6, then within 2 hours, they are fully dilated. It is not meant to happen, but sometimes it does happen. Yeah.
So sometimes we hear, okay, like you mentioned, first time moms, the 20 hours of laboring. So in that 20 hours, I'm moving from centimeter to centimeter to finally 10 centimeters.
Yes.
And is there a point, at what point do you say that you're taking too long, that now we cannot do a vaginal delivery and now we have to take it to CS? Because is it that I did not fully dilate in the 20 hours? Or what's the mark? Do we stop at 20 and say you're taking too long? At hour 21, we're taking you to CS.
So for first-time moms, if you get to active phase of labor at 5 centimeters, now for us you are active. So we expect that after every 2 hours you'll be dilating 1 centimeter. So we'll give you from the time that we did vaginal exam that how many hours you're supposed to deliver during that part. That is dilatation only. But for labor to happen per vagina, there are a lot of factors to consider. Before we know, we are now not able to wait for vaginal delivery, we are going in for an emergency CS. So there is the baby. The passenger is the baby.
Yes.
It's a factor for us. This passenger needs to be well from when you start your labor until the very time. The passenger need to wait on us. We are laboring, yes, we are on 18th hour, yes, but the passenger is still okay. So we are good to wait for vaginal delivery. There is the power. The power is the contraction. Is it enough for us? We can't deliver when you are in mild. We have to get to mild, to moderate, to strong. Because the power pushes the baby towards the birth canal.
Yes.
Then now there is the passage. The passage is now the cervix. Is it dilating? Dilatation, is it corresponding to how much strength we have and how the baby is descending the passenger? So maybe the passenger is okay, the power is enough, but we don't have a passage. So we go in, okay? So maybe the passage is okay, we are 8 centimeters, we are waiting like an hour or 2 to get to 10. But now the passenger is saying, I'm tired, guys. I can't breathe. Yes. Now we have to go in because the passenger cannot wait for the next 2 hours. The moment our fetus shows signs of distress, we can't wait for a 30-minute or an hour. It can turn to something else. That's how we say we go moving in for CS. Then maybe the passenger is okay, the passage is okay, but we don't have power. And the more we wait for the power to advance, the more this passenger will will get tired.
Oh, yes.
So it's a lot of factors to consider. Of course, we always walk the journey with you so that you're able to know this is where we are and this is our expectation in an hour. So that even yourself as a mom, you're the one who will be asking us. You guys said you're supposed to be 8 by now, but we are not 8, okay? So it's always a journey that we involve you in your care so that you're able to know the steps that we are following so that when we get advanced to CS, you're able also to say, you guys, you have to save this passenger.
Yes.
The passenger is tired.
Yes.
Because we always show you the fetal heart rates, they're normal, they're not normal. So even you, by the time they're getting to below 120, you already know the baby was kicking and the fetal heart rates were 138 or and above, or they're normal. And now why are we 110? Yes.
It's cause for alarm.
Yeah, sure.
Okay. And we've been mentioned, I think there's something we forgot. Because we were talking about labor now as you go into up until 10 centimeters and now that means you're delivering. But then there are stages of labor. We spoke about the early stage. Then I'm thinking there's another stage before we get to labor. Not to labor, to delivery. Maybe you can walk us through the stages of labor.
So we have 3 stages of labor. The first stage of labor is when you are in your active phase, which we said 5 centimeter. Until now you're fully dilated. Passenger is okay, passage is okay, then we have power. Now that is there up to the first stage of labor. We are 10 now. The first stage is out. We are getting into second stage. From when we are 10 until the passenger is out, okay, the placenta is out. Now that is the second stage of labor. Yes.
You said 3 stages.
Yes. Now the third stage of labor is when post placenta, we clean the mom, we dress, you shower, then we go to breastfeed.
To breastfeed.
Yes. And
So-
now the continuity of care.
Yes.
Postnatal. Yeah, sure.
So the 3 stages. So the third stage is the one that you push the placenta. Do you push the way you pushed the baby?
So it's a natural happening. So you're not supposed to push it. It's supposed to come like naturally. The baby is out. You're separating you, the cord, and the mother. Then the placenta should follow naturally.
So you
Of course,
feel
we
nothing.
enhance that with medication. We give you an oxytocin immediately after delivery when the baby is okay. Then it helps, of course, to expel the placenta.
When you say you give the mother an oxytocin, what do you mean exactly?
Oxytocin is a drug. It helps with the contraction of the uterus back to its normalcy. Then it also helps the uterus to expel the placenta.
Oh,
Yes.
if I see that this is not happening, is this something I can ask? Can I ask?
Sure,
for
you
the
can ask.
So mothers should know that they should ask for the oxytocin after they've given. But do you?
Of course,
are
we
they
always
still
do,
are
we
they
do it
sober mind?
naturally. They're not. During that time,
to
they're not. Of
remember.
course, that time is either when the partner is there, we'll be watching. Of course, as we said earlier, we take you through the journey. So
Yes.
we'll know what happens when. So when you're doing oxytocin, normally for nurses, we always shout, oxytocin in or injected. So you always know. Maybe you can hear it at very far,
Yes.
but we always give oxytocin. It's a mandatory. Immediately after delivery, we give.
And
Because
that's-
it also helps with the placenta.
Oh, with the placenta.
Yeah.
And that's the same for either CS or vaginal delivery.
It's either.
Ah.
It's the same, yes.
So I know if I choose RFH, I'm in good hands. They already know, this is already standard procedure that they do
They
across
do
all your
across the
branches.
branches, yes.
Okay, that sounds
Yeah.
great. So I want us to now speak on the myths that surround labor. Maybe you can share, because you've been in this field, you've had so many myths from so many moms, and you can help us debunk this myth so that at least whoever is watching can tell that this is actually not a fact. Yeah.
So for the myths, we have several. It depends from one mom to the next. So people say, my water must break before I go into labor. We said no, that's a myth. The truth is, you can go into labor before your water breaks. So contraction can come advanced to you go to the facility, getting admitted, staying there for even 4 hours before your water actually breaks. Yes. So some also say, I have to get strong contraction before I know I'm in labor. That is not true. Your labor starts from mild to moderate strong. Yes, so they don't need to start from nowhere, they are strong. Yeah. Then some say, I have to get a bloody mucus plug. It could be just a mucus plug without blood.
Oh yeah, the bloody
Still,
show.
yes. So it doesn't mean it should be bloody. It will advance as you progress in labor. But if you notice that you have a mucus plug, that's already a sign. So it will advance, yes, but you don't need to wait it advance when you are home.
Okay.
Yeah.
So the bloody show, is that it's not a myth, but does everyone get a bloody show?
Some get it immediately when they start the labor. Some get in advanced stages of labor.
Oh, so at some point you will still get
You
it.
will still get it.
Ah,
Yeah.
okay, all right, okay. So does it? Is it a myth that as soon as we hear? But you already said as soon as we hear contraction, we should go to the hospital. So that's not a myth.
Yeah, that's not a myth.
But it does not mean that contractions mean labor is starting any minute.
Yeah.
So it is a myth.
Okay, it depends. It depends with how, I said it depends with how you monitor those your contractions.
Yes.
We always say within 5 minutes, how long does they last? Within 1 hour, how many of you have you received the contractions? So it is very regular, then it increases in such a way that when you are at 1 p.m., you get labor. In the next 30 minutes, it will be stronger than the one that you perceived. Yes.
Is there a way you can time it yourself before I
It
get
is
to
rhythmic, so you can.
Yeah, you can.
Let's say after every 5 minutes, you feel something. Then after another 5 minutes, you feel something. So it's very rhythmic, so you can always tell.
Okay.
Yeah.
So is that a question I'll be asked when I get to hospital?
Yes.
Like,
When did it start? We will always ask you that.
so
yes.
you'll tell her, so you have to keep that in mind with my
that at what time,
with my not so sober mind.
Yes, you have to keep that in mind. Just say at what time did it start,
Yes.
and what are the characteristics? Does it increase with time? The intensity? Does the frequency increase? So we'll have to ask you that.
Okay.
So your partner can be able to say 1, 2, 3, but you're the principal member of that pain, so you're supposed to tell us. Yes.
Okay.
Yeah.
So another myth I had is that you will definitely know when you're in labor. Is that a myth? Or like someone will tell you, don't worry, you will know. You're just, you will know. Usijali, utajua umeanza. Is that something that I will be like, because I'm a mother, it should come to me naturally. So I will just wait. And
So if you're a first-time mom, anxiety can confuse you with labor. So few weeks before delivery, from week 36 to week 38, you start dreaming of labor. You always dream like, I delivered, I went to the hospital, now I had my baby. Then you wake up, then you're still pregnant, okay? So it will confuse you at some point. But if it advanced or if it comes like you're now having real labor, what happens, some mothers, you will not be able to speak, you will not be able to walk. Now you realize, guys, we are in labor. We need to go. We need to move. This is it.
true.
This is it. This is now true.
This
It is
is
not
now the
anxiety,
real
it's not the drama. It is true now, we need to go.
Okay.
So you will feel pressure
Yes.
in your pelvic. Of course, it depends. Then you will feel like a more of discomfort. Then the pain now comes in. Now you realize it's the cramp pain. It's now a real pain. Lower abdominal or lower back pain, which does not go away, regardless of what you
changing positions,
Even if
drinking
you
water.
It will not go away.
Even if I decide to sit on a
It
ball
will not
at
go
home and
away.
not
Yeah,
go
it
to
will
the
not go
hospital.
away. Yeah.
Okay, all right.
Yeah.
So I just want to ask, as we conclude, you've seen this mothers coming in, you've taken them through labor and all that. What is the one key thing you can tell a mom who is in labor? Or yes, given the signs that we've shared, what is the key thing you can tell that mom when labor starts for you? This is what you should keep in mind.
So we always tell the mothers, trust the process. When you are able, ask as several questions as possible so that you know what you expect in the next stage. They're telling you a 6 centimeter, ask, at what point will we get to here? Is the baby okay? Is the power enough? So that at least we don't come to you that we need to increase the power and you are not in copy. So you should ask those particular questions. If you need emotional support from your partner, we'll call them from home. They will come and support you. If that is what making your labor to be easy, we will call the person and the partner will come. Okay? Yes. So always, again, we say if your baby was kicking or you are still sober enough to differentiate between pain and how the baby moves, always keep that in mind. So that when the moves changes, unless we are advancing into maybe 8 centimeters or something, you should know.
Something has changed.
Yes, something has changed. So just raise an alarm and tell the nurses that we are not moving the way you were moving the past 2 hours. So we get to listen for the total heart rate. Then you are able to know the passenger is okay, he's concentrating to come out. So we are good. So you are supposed to know all those things. Yes. Yeah.
Okay. So I think we've tackled everything I had, unless there's something you feel you would also want to share that maybe we've already spoken about, but you maybe want to add on. You can share that.
So if you're watching on Science of Labor, also don't forget your danger signs. Okay. So danger signs are those pregnancy signs or labor signs which will make you come to the facility without you being in labor. Okay. You may be on your 37th week and the baby is not moving the way the baby is supposed to move. That's a danger sign. Okay. Your water can break. We say it's supposed to have a metallic smell.
Yes.
If it is foul smell, we are not good. So keep that in mind and inform your midwife or your gynecologist. You're supposed to know. Okay. If you see blood, there's a difference between a shock and a blood. Blood is very fresh. You just feel a gush of blood. You're supposed to keep that in. That's a danger sign.
No, that's not a bloody show.
It's not a bloody show. It's always just maybe blood or a very big spotting. A spotting you can tell is maybe the size of a panty liner or it progresses with time. It started small, then now it's medium or something like that. You're supposed to keep that in mind also. Then it could be you're feeling headache, which is not going away with drinking of water, position. It could be your pressure. It's maybe in the late stages of pregnancy. So those are some of the danger signs that you should not mix with with labor pains. So you can mix them in such a way that say, I was feeling headache because I was in labor. No, you are not supposed to feel headache. You are not sick. You're just in labor.
Oh, yes.
So the labor is supposed to contain from the lower abdomen to your lower back. Any other place is supposed to be okay.
Yes.
So you getting into maybe a severe headache with a bloody vision which you're not able to see, you're supposed to get worried. So don't mix the danger signs or don't forget your danger signs as we progress towards labor and delivery.
Oh, that's actually a very good point, because I think moms think it's like pregnancy is a sickness. So
no, you're not
and
sick.
Because I'm already close to giving birth, it must be a sign. I'm tired.
Yeah, you're
That's
tired.
That's why I'm having a headache.
Sure.
Okay.
We also say you are not supposed to get tired in such a way that you cannot even lift a cup. No, you're not sick. You're just pregnant.
You're just pregnant.
Yes,
it's not a sickness.
It's not a sickness. So you're supposed to do your day-to-day activity, even if it is not a lot. That small chores you're supposed to do. So if anytime you're not able to bend, you're not able to walk, you're supposed to get worried. Maybe the baby is not lying all right. Maybe the position changed.
Yes.
So you need to get seen.
Because the baby will still be kicking the same way. Even until the last minute.
So at the last minute, let's say week 36 towards the delivery, it changes. It reduces, but it maintains. If the baby was kicking 10 times in a day, it changes to 8, but it maintains 8 like today, tomorrow, 1 week, 2 weeks. Then it changes maybe to 6. It maintains that 6 to like until delivery. So it reduces, but it maintains. It doesn't like the whole day the baby has not kicked. No.
Okay.
That's a danger sign.
So at what, because you said it reduces like from 10 kicks to maybe 6 weeks. So where can I say that this is extreme reduction? Is it like maybe if I feel maybe 4 kicks, or maybe I feel today the kicks or maybe 2 times? At what point do I say, I know I'm already close to delivering this baby, but this is not this is not right?
It depends. My baby could be active during the night, yours is active during the day. So how many of those kicks do we experience during the day? So let's say by around 10 you're supposed to get 3 of them, but today there is none. Well, there was only 1 at 8. So you're supposed to start saying what's happening with the baby. Then you get to midday, it is still 1. So we are not okay. So it depends with the pattern. For a mother, you have mastered the pattern of when is your baby kicking.
Yeah, true.
For some mothers, you even sit down. We are almost kicking. Please allow me to sit down. Now you sit and wait for the baby to kick.
Because you've been having these kicks throughout the entire period. All right. I think we've covered everything. thank you so much for being here. I really enjoyed this session, and I'm sure our viewers have as well. You mentioned you at RFH, which branch?
I'm at Roy branch.
Roy branch.
Yes, the one opposite mosque, the mother branch.
The mother
yes,
branch.
The mother branch.
So if we want to see Naskisera, we come to the mother branch.
Yes, you come to the mother
Yes,
branch.
I come to the mother branch.
Yes,
for all those questions we have,
you can
all
come.
those fears
you can
and
walk
doubts.
the journey with you. All the fears, we clear all the myths, the theories, so that you're able to work with facts. It will help us diagnose any complication that may come there about.
That
so the early the
essential.
better.
The early
yes,
the better.
Yes, and the
That
right
is
information
key.
is okay.
Yeah, the
Yes,
early the
yes,
better.
the early the better.
We should not assume.
We should not assume. Because normally sometimes you assume, then the mother comes and say, you see, I had labor yesterday. Then you come walking and seeing us, then you go back with the baby the following day.
And you're not expecting
you are not expecting. Everybody is agreeing to bring you clothes. They're saying you're joking. You just left here.
You just look like you're going.
Left here. What are you saying? You have a baby. Like, hey, you have a baby. Then I take the phone and like, you guys bring us clothes. The baby
is here already.
Yes, the baby is here already. So the early the better. It's always you come early, we tell you you're okay, you can go back home from our examination than now you waiting until now you are there, the baby is there, you don't have clothes, you came to visit, now the baby is there. Now we don't have anything to do, yes.
Oh, I know you said you are concluding, but there's something else. You said you can come and then we send you back home.
Yes.
Is it true that I can get, okay, again, personal experience. At some point when I was giving birth to my first baby, I got induced, but was allowed to go back home for another 6 hours. But I will keep the hospital, wherever the hospital is. But is that something that's safe? I was told it was not safe.
It is not safe. The moment we start mechanism of induction, we are not supposed to let you go.
Is it because of the method of induction? Because I was given a pill, the one that you put under your tongue. So is that because I was assured that this means it will not kickstart until very late. So you can go back home. Does it matter?
It is very risky because I said there is a mother who can start their contraction at first dose. That small dose. Within 1 hour, the contraction has peaked and we're not continuing contraction. We now continue monitoring the labor. Then there is a mother who is on dose number 5 and 6 sleeping or still lying down, but the baby is okay. The contraction has not peaked, the dilatation is not even happening. So it is risky. The moment you start, we monitor that mother very closely. We can even experience precipitate labor, depending on, during that particular time, how prepared was your cervix. Maybe your cervix was soft, very short, it is just there. Then you get a kick of contraction, it dilates.
And you already went home.
Yes, you already went home.
So it does not depend. Oh, you're not supposed to
go home.
So at least so I can share with other mothers.
Yes, please. We can only allow you to go home when you came and you did not know that you are going to induce you.
Yes.
So we explain the whole process. Then if you don't have anybody maybe to bring for you the clothes, we release you to go.
To fast school.
Then come back.
But not induce you then go and get your clothes.
No. We never know. Every minute counts.
So it does not depend with the method of.
It doesn't depend with the method.
Oh,
once we give you the drug,
it can work different for anyone.
For anyone. From different pregnancies.
Then let me say I was lucky.
You are lucky.
You are lucky because I got to the house.
You are very
I showered,
lucky.
I ate, I took my bag and went. When I got back is when the contraction.
You're very lucky. Yeah,
my passenger waited.
Yeah, your passenger was a very nice person.
Very nice passenger, even though they were very late.
The passenger was sure. You're not supposed to go back home immediately. We start back.
All right.
Yeah.
Oh, thank you. So I feel like we can go on and on and go on. I think what I'll do is I'll now come and look for you at the main branch to continue this conversation.
Anytime. We want to make it as easy as possible for the mother. So you're just pregnant, you're not sick.
Yes.
The journey should be smooth, as predicted. If anything comes, we tackle it and then you go back to your normal.
Thank you. That is very good to know.
Yeah.
So, and that concludes our episode for today. I feel everything has been answered in the best way possible. As you've heard, if you want to speak more, if you have any questions, any doubts, as a mom, we know this come all the time. You can work with RFH. They are there to hold your hand throughout the journey. As you know, we have now Naskisera. You can go to the main branch and ask for her specifically. So if you have any comments, please share with us in the comment section. Remember to like this episode, share with your friends, and don't forget to subscribe. Until next time, it's been a pleasure. Bye-bye.